What is the science behind the HPV vaccine's protection? Imagine a shield built to match the shape of a virus, ready to block it before it can cause harm. That's essentially how the HPV vaccine works. It trains your immune system to recognize and fight human papillomavirus, or HPV, by producing high levels of neutralizing antibodies. These antibodies act like vigilant guards, preventing the virus from attaching to and infecting your cells. If the virus can't infect cells, it can't cause the health problems linked to HPV, like cervical cancer, genital warts, or other precancerous changes. The vaccine is made from virus-like particles, called VLPs, which are crafted from the L1 protein, the main building block of the HPV outer shell. These particles look just like the real virus but contain no genetic material, so they can't cause infection or disease. Because they mimic the virus's structure, they effectively stimulate your immune system to produce a strong response without any risk of getting sick from the vaccine itself. When you receive the vaccine, your immune system responds by creating neutralizing antibodies, mainly through B cells. These antibodies are highly specific. They recognize the HPV types included in the vaccine and bind to them, blocking the virus from attaching to your skin or mucous membranes. This neutralization prevents the virus from entering your cells and establishing an infection. Alongside antibody production, the vaccine also stimulates T cell responses, which may help in controlling infected or abnormal cells, though the main protection comes from the antibodies. Clinical studies show that the HPV vaccine is very effective, especially when given before any exposure to the virus. It can prevent up to 98% of cervical precancerous lesions caused by the HPV types it covers. The vaccine also protects against other HPV-related conditions like genital warts and precancerous changes in the vulva and vagina. Because it targets specific high-risk HPV types, the vaccine's protection is strongest when administered before sexual activity begins, which is why vaccination programs often recommend it for preteens and teenagers. It's important to note that the HPV vaccine does not treat or clear existing infections. Its primary role is prevention. If someone already has an HPV infection, the vaccine won't eliminate it, but it can still provide protection against other types of HPV they haven't yet encountered. Some newer research suggests vaccination might help reduce recurrence of HPV-related lesions, but this is still being studied and is not the main reason for vaccination. Different HPV vaccines cover different types of the virus. For example, Gardasil 9 protects against 9 HPV types responsible for most HPV-related cancers and genital warts. This broad coverage enhances the vaccine's ability to prevent a wide range of HPV-associated health issues. Some vaccines include adjuvants, like aluminum compounds, which boost the immune response, leading to higher and longer-lasting antibody levels. When many people get vaccinated, it doesn't just protect individuals but also helps create herd immunity. This means that even those who aren't vaccinated benefit because the overall prevalence of HPV in the community decreases, lowering the chances of transmission. In summary, the HPV vaccine works by mimicking the virus's outer shell to safely stimulate your immune system. It produces antibodies that neutralize HPV, preventing infection and reducing the risk of HPV-related cancers and diseases. It's most effective when given before exposure to the virus, making vaccination a powerful tool in preventing HPV-related health problems. Always consult healthcare professionals for personalized advice and to determine the best timing for vaccination.